London.
So the government announced, didn't it, that it's sending letters to the 1.5 million people most at risk of coronavirus to stay at home for 12 weeks to protect themselves. It includes organ transplant recipients, cancer patients and those with severe respiratory conditions. Alice Bandukravi has been finding out about the impact it could have on them and the challenge facing local authorities supporting them.
The NHS has identified up to 1.5 million people in England who face the highest risk of being hospitalised by the virus. The NHS will be contacting these people in the coming days, urging them to stay at home for a period of at least 12 weeks.
The Communities Secretary announcing plans to protect the so-called shielded, the group of the most vulnerable who will be getting an extra package of support. They include people who've had organ transplants, people with specific cancers and people with severe respiratory conditions. The full list of who's considered extremely vulnerable is online at gov.uk/coronavirus. Meet the Leighton Popes. 15 years ago, Jake needed a kidney transplant, so his mother Pamela gave him one of hers. They are now part of the shielded group.
I'm perfectly well. If you met me in the street or in a pub, you would think nothing of it, but a chronic disease is chronic in its nature, that it doesn't go away. So we're always feeling certainly on edge as people with these kind of conditions. And then you throw something like COVID-19 into the mix and suddenly you're thrown back into a real high state of alert, and it is a fear situation for us, I think.
And for that reason, local councils are pulling out all the stops to look out for the most vulnerable.
My colleagues and I at Hammersmith and Fulham Council have been working to prepare for this for over a month, 7 days a week, all waking hours. And I've never known a time when London leaders across the capital and indeed at all levels of government have worked together, despite party differences, to get us ready to tackle this.
I have been so humbled by the response of the general public. We have set up a platform called Westminster Connects to bring together those volunteering and community organisations with those that need help. And so far we have had over 1,000 people who have registered on our website to help.
1.5 million people will need to spend the next 12 weeks at home. Their lives could depend on it.
This shielding will do more than any other single measure that we are setting out to save life.
Alice Bandukravi, BBC London.
Well, we can talk now to